Hello students, now we'll study STDs. STDs means sexually transmitted diseases. What is STD? Sexually transmitted diseases. Okay, sexually transmitted diseases. It can be seen in both male and female. How it can be seen? When male or female does unprotected, remember this word, unprotected what? Intercourse, unprotected coitus or intercourse. When they do unprotected intercourse, okay, not wearing any condoms, not wearing any contraceptive, not following any contraceptive methods, or not wearing any devices, okay, contraceptive devices I am speaking about, okay, in that case, okay, the disease of infected person, okay, it you may tell that, sir, how can it tell that? You don't know, right? Unless until the male or female has to tell, like, I have the sexual transmitted disease, so that don't intercourse. That time you have possibility of stopping the intercourse. No one knows early symptoms, even she maybe doesn't know, male also doesn't know. In that case it's very difficult. Okay, coming to the point, sexual transmitted diseases are usually, okay, transmit from A person to B person. A person should be infected person. This is transferred to the, either maybe he may be infected or non-infected person. Okay, it may be transmitted from A person to B person. Okay, he should be infected person. He may or may not be infected person. Okay. Now coming to the point, this kind of diseases already discussed in Human Health and Disease chapter. Okay. Now I am discussing because some of the diseases they have given in reproductive health. These are the diseases with respect to the, okay, urinary tract infection, or the is a penis infection, or the vaginal infection. These all infections initially takes, okay, when you do unprotected intercourse. Some of the diseases we'll see, because this kind of diseases mainly seen or mainly affected by sexual workers. Okay, AIDS was first identified in India, that too in China. Okay, it was not China, not China, it's in China, sorry. It is in China. It is first AIDS patient, means HIV patient is identified in China. Okay, it is identified in China, sexual worker. Okay, in her it is identified that HIV virus first in India, we can say. Now coming to the point, okay, there are few diseases we'll study now. Okay, those diseases are AIDS, as you all know, acquired immunodeficiency syndrome. Okay, these are the acquired immunodeficiency syndrome. Okay, virus is human immunodeficiency virus, or HIV1. There are nowadays HIV2. If you go to any major OT, this test is mandatory, means operation. Any OT, they will perform this, then only they will take you to the OT. Okay. Next, hepatitis B is a hepatitis B virus. Okay, it is also very dangerous virus. This will affect usually liver. This will affect lymphocytes. Okay. In a need, there may be chances of asking, AIDS will affect what? Lymphocytes initially. It will not affect urinary tract, means genital parts. Genital parts means penis or vagina. It will not affect. But the origin from there, the origin of transmitting the disease, STD disease, from there only, but site of infection is somewhere else. Okay, it is lymphocytes. Okay, here liver, mainly liver. Okay, it's not Johnny liver, it's a liver. Genital warts is a human papilloma virus. Syphilis, Treponema pallidum. This is a bacterial infection. Next, gonorrhea, Neisseria gonorrhea. It's also bacteria. Next, chlamydiasis is a Chlamydia trichomatis. Chlamydia trichomatis is a bacteria again. Trichomonasis is a Trichomonasis vaginalis. Trichomonasis vaginalis is also protozoa disease. Genital herpes is a herpes simplex virus. This is also rare case. If we get a genital herpes also, it will not go easily. Okay, it is a what you say? It is a brother of AIDS. We can say small brother of the AIDS. We can say this one also. But the STD diseases high in age 15 to 24. Usually, STD diseases, sexual transmitted diseases, seen in 15 to you may consider 30 also, no issues. And non-curable STDs are usually AIDS and Hepatitis B. Okay, we can stop the inflammation. I am not telling if you get that disease. Okay, if in the initial stage we can stop the inflammation, there are chances of getting cured, but not the 100%. There will be some 1 to 2% will be there. 100% is not possible. Okay. Next, AIDS, lymphocytes, Hepatitis B, liver mainly site of infection. Transmission of AIDS and hepatitis B diseases are what are the reason? Unprotected sex with the infected person. As I told, mainly STD diseases are, we will invite the STD diseases when you have unprotected sex. If you are having unprotected sex with only one partner, then there's a chance getting less. Okay, if you are having unprotected like sex with multiple partners, usually some boys will have multiple partners, or a male you can say. If he is having unprotected sex with multiple females, if one of female is having STDs, then if we assume D is having a STD, then he had an intercourse D, B, C, means all three will get infected, including him also. Okay, infected persons here are 1, 2, 3, 4. Like this, if you do unprotected, so better wear any contraceptive or protection before doing the intercourse with the multiple partners. Transfusion of unscreened blood and blood product. What it will happen during the urgency? Blood is not screened. It's not tested, not screened properly. That kind of time, if IP person is there, STD means infected person, blood is having STD disease, then it will transfer to like uninfected, means not infected persons also. You should be careful. Okay, by kissing, okay, just hugging, means kissing means not the French kiss. It's just a slight kiss on the cheek. Okay, not on lips. Okay, or hugging, by sharing the meal in his plate, by sharing the swimming pool, by sharing his clothes, AIDS will not transmit. Remember that one. Okay, by giving the shake hand, by hugging, okay, by giving the gentle kiss on the cheek, okay, or by sharing the swimming pool or the water or the toilet, or by eating in his same plate, okay, AIDS will not transmit. Okay, there are some myths, we need to eliminate that. We should educate the people. Okay, next, sharing of the contaminated needles and syringes and surgical instruments of IP person. Of IP person. IP means infected person. Okay, you should not share. Okay, in home also you should not use your brother, okay, father shaving kit. You should use, if you want to use it, sterilize it properly or sanitize it properly, then dry it, then use it. Blade should be changed. Okay, you should not use same blades. Okay. Next, from infected mother to fetus. Okay, from infected mother to fetus, there is chances of transferring the STD. Mainly these two diseases, AIDS and Hepatitis B. What are the early symptoms? Early symptoms are itching, swelling, fluid discharge. Fluid discharge may be in the vagina, which is vagina opening or vaginal cavity, or the penis. Glans penis has a secretion Okay, yellowish color, then it has a foul smell. Okay, if that's foul smell, again it leads to the fungal infection or the bacterial infection. Again, the first formation, if you go to that, you need, doctor has to perform some surgical on that particular part. Okay, and slight pain in the genital region. If there is a pain, will be there always. If infection is there, pain and itching and swelling will be there. Okay, this completes the STDs. Okay, STDs means sexually transmitted diseases. I'll quickly 1 minute I'll tell in Kannada. Sexual transmitted disease andre ಯಾವಾಗ ನಾವು ಅನ್ಪ್ರೊಟೆಕ್ಟೆಡ್ ಸಂಭೋಗ ಮಾಡ್ತೇವೆ, ಮೀನ್ಸ್ ಅನ್ಪ್ರೊಟೆಕ್ಟೆಡ್ ಅಂದ್ರೆ ಯಾವುದೇ ಪ್ರೊಟೆಕ್ಷನ್ ಇಲ್ಲಾರ್ದ ಸಂಭೋಗ ಮಾಡಿದಾಗ ಈ ರೀತಿಯಾದ ಡಿಸೀಸಸ್ ಬರ್ತದೆ. ಅದರಲ್ಲಿ ಕೆಲವೊಂದು ಡಿಸೀಸಸ್ ಏಡ್ಸ್, ಹೆಪಟೈಟಿಸ್ ಬಿ, ಜೆನಿಟಲ್ ವಾರ್ಡ್ಸ್, ಸಿಫಿಲಿಸ್, ಗೊನೇರಿಯಾ, ಕ್ಲಾಮೈಡಸ್ ಅಂಡ್ ಟ್ರೈಕೋಮೊನಾಸಿಸ್, ಜೆನಿಟಲ್ ಹರ್ಪಿಸ್. ಇದು ಡಿಸೀಸಸ್. ಇದು ಮೇಲ್ ಅಲ್ಲಿ ನೋಡ್ಲಿಕ್ಕೆ ಸಿಗುತ್ತೆ, ಫೀಮೇಲ್ ಅಲ್ಲಿ ನೋಡ್ಲಿಕ್ಕೆ ಸಿಗುತ್ತೆ. ಅದರಲ್ಲಿ ಸ್ವಲ್ಪ ಸ್ವಲ್ಪ ಡೇಂಜರಸ್ ಅಂದ್ರೆ ಏಡ್ಸ್ ಮತ್ತೆ ಹೆಪಟೈಟಿಸ್ ಬಿ. ಇದರಲ್ಲಿ ಇಷ್ಟು ರೀಸನ್: ಅನ್ಪ್ರೊಟೆಕ್ಟೆಡ್ ಸೆಕ್ಸ್, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್, ಶೇರಿಂಗ್ ಆಫ್ ದಿ ನೀಡಲ್ ಆರ್ ಸಿರಿಂಜ್ ಫ್ರಮ್ ದಿ ಇನ್ಫೆಕ್ಟೆಡ್ ಮದರ್ ಟು ದಿ ಫೀಟಸ್. ಓಕೆ, ನಾವು ಇಟ್ ಇಸ್ ಮೇನ್ಲಿ ಸೀನ್ ಅಂದ್ರೆ ಇದು ಜಾಸ್ತಿ ವಯಸ್ಕರಲ್ಲಿ, ಯಂಗ್ ವಯಸ್ಕರ್ ಮೀನ್ಸ್ 15 to 25 or 30 years ಅಲ್ಲಿ ಜಾಸ್ತಿ ಇರ್ತದೆ. ದಟ್ ಟೈಮ್ ಓನ್ಲಿ ಇಟ್ ಇಸ್ ಕಾಲ್ಡ್ more excited age of having the desire of having this sex with the multiple partners, maybe unprotected sex with their sex workers. Okay, after this, why can't be more than 30, 40, 50? Because that time, if you speak, they are married. That time they have settled. This is the, I will say, monkey age. Because of that age, you will be always up doing some experiment. I want to do today something new. Let's see. Okay, if you do experiment, that will affect you on. Okay, you should not. I'll tell you can have multiple intercourse with multiple persons, but be careful while doing that. So you should be use protective, like protective condoms or cervical caps. Okay, caps or silicone caps. Okay, there are which are available in market. You should do. If once you got infected, you will feel like not only affected by this disease, that disease again make the sub disease. Okay, you will suffer from the diseases. Because of AIDS, people will not die. Because of a series of diseases, people will die. Okay, now we conclude AIDS is the main reason of the unprotected sex, and now STDs are also sexual transmitted diseases, mainly unprotected sex. This is mainly because of the site of origin is penis and vagina. Okay, thank you.